we already heard even Honorable Minister Umi also said that it's important to have the foundations for the private sector to thrive. So the policies, the legislation, the legal framework, that really, the certainty in the policy environment, the stability there, for giving confidence to the private sector to engage, to make investments from their side. So it is, what I would say is that there are some areas where we can expect a bigger role from the private sector in the human development, and that is in skills development, for instance. That's one area where the private sector can play a big role in providing these, the training and the building the capacity and the skilled labor force, especially in the health labor force. There is a lot of opportunity for the private sector to come in, and then also in the manufacturing, in the pharmaceutical industry, there is a big role for the private sector, and we also have really like to see the private sector provide to come in more on the on education. So there is really scope, but what we need is for the government to provide that foundation for the private sector to be confident about engaging and having policy and regulatory framework that provides some certainty to the private sector is really critical in that regard.
Thank you very much, Preeti. Now I'd like to move on to Charlene. Preeti mentioned about the human capital index being 0.4%, and you also mentioned the issues related to nutrition and childhood development. And you being in UNICEF is an entity that deals with nutrition and the child development. Now, my question to you will be, as you know that Tanzania is being faced with a double burden of malnutrition. We have a problem with the undernutrition, but also the problem of overnutrition. And there's not enough budget that is being set aside to address the problem of malnutrition, but also childhood development. So what can the private sector do to bridge this gap or to complement the efforts of the governments?
Great. Dr. Faustin, thank you very much. Let me pedal back a little bit from what you said. And you're absolutely right. Tanzania has actually made huge progress when it comes to stunting reduction. We're down to almost from 42% to 30% of children under 5 stunted. But there are two other issues giving us what's called now the triple burden of malnutrition. As you rightly pointed out, if you look at women in the reproductive ages, 15 to 49, levels of obesity, overweight are at 30%. Can you hear me? Yes. Yeah? Okay. Okay, is this better? Yes, okay. So I was pedaling back a little bit and saying, absolutely, Tanzania does face huge issues around malnutrition. It's made excellent progress on reducing under 5 stunting. We're down from 42% to about 30% of children under 5 stunted. You rightly said, Dr. Faustin, we've got this burden of overweight, obesity, really pressing, especially amongst women in reproductive age group 15 to 49, where it's almost at 30% women being overweight or obese. And then we have a triple burden, which is in the same age group, 30% of women not having enough micronutrients. So that's one set of issues I wanted to start off with. And I also want to place one more issue on all of our minds. To achieve the potential that Preeti was talking about of every child, we have to keep children of today in view, so almost 23 million under 18. We'll have 30 million under 18 very soon. And then At 2050, we'll have doubled that figure in the URT. 60 million children under 18 by the time we come to 2050. So we have, whatever we do today, we have to bring the future into today. And all of you have touched on that. And the way to do is do this for ourselves, for universal health coverage, for eliminating the triple forms of malnutrition. It cannot be business as usual. We won't be able to tackle that with the tools of today. So innovation, particularly with the private sector, is key. So having said the rhetorical bit, let me give you a few very, very specific examples on how we can do this in the nutrition sector. First of all, human resources for health. Your Honorable Minister Dada Yangu, Minister Umi Mwalimu, Minister Mazrui, Dr. Ellen, you all mentioned the role that private sector can play, particularly to fill the huge human resources gap. And as our population expands, we will need to go outside to our volunteers, to our community health workers, to fill this huge gap. So that's the first one. The second is, and this was mentioned by Mamita in a different way, it's the strengthening the food supply chain. So looking at the role of the private sector in innovation, especially in a blessed country like Tanzania, which is food sufficient, we should not be having these triple forms of malnutrition. So the private sector's role, be it in processing or food fortification, transportation, last mile delivery, is hugely, hugely important. And I think we can really seize the momentum of this commitment and move forward on this. The third is nutrition commodities. And we hear, as you rightly pointed out, Minister, COVID really is making countries think of national capacity, national self-resilience. So small things from, say, nutrition commodities that can help detect and prevent, like, measuring tapes around the arms, right? Like weighing scales, or indeed vitamin A, deworming, iron folic acid. Tanzanian private sector can look at how to fill the gap here and make sure that we are, of course, in a competitive way, if it is indeed competitive to do so, expand that role. The fourth, and again I want to come back, Mamita, to your words, promoting safe food environment. There's a huge imperative today on the private sector, not just to look for a viable market for foods, for selling food product, but really making that shared value, social contract come true in promoting food that does not promote obesity, that does not lead to overweight, that does not further aggravate the micronutrient deficiency. It has to make profit, but it also has to be a committed shared value partner in URT's development. Otherwise, the cost of burden, sadly to you, Mama Dada Umi, on reducing health expenditures, particularly for NCDs, is going to be very high, and same for you, Your Excellency, and we need to reduce out-of-pocket expenditure, and private sector will have to play a responsible and an investment role in that. And lastly, and I say this as a mother, and all of you working mothers in the room, you will agree with me that the private sector can set the benchmark for ensuring women-friendly, family-friendly policies so that every woman can breastfeed her child for as long as she wants, including at work, making those spaces available, making your workplace child-friendly, so that indeed the private sector can set the benchmarks for the public sector on this count. And I'm looking to you, Mamita, as my champion on this one. Aga Khan is already there, but I'm going to look to you to be a champion.
Thank you. Thank you very much, Charlene, for that contribution. Now, you've spoken on a number of initiatives and what can be done. But I just wanted to ask you, in your own assessment, what has been achieved and what needs to be done going forward?
So, what's been achieved, right? I think Preeti started with this. None of us would be in this room had we not had the huge leadership commitment to the social development sector, to the sustainable development goals by Her Excellency Mama Samiha, our President, what Dada Umi is doing and the work that you're doing here, Dr. Mazrui. So huge leadership and commitment to the social sectors, without which the economic sectors cannot move ahead, right? So I think that really needs to be credited, recognized time and again, because we cannot take it for granted. Yeah. The second point I want to raise is, and we've seen this huge commitment to universal health coverage, particularly the primary health care. We heard from Ellen something very small in her speech, operationalizing the community health workers guideline. That may just be a phrase, but investing in primary health care, particularly linking the community to the facility, that can only be done by these volunteer workers at the scale that is going to be needed in Tanzania today and Tanzania tomorrow. That is the best way to reduce overweight, right? Just prevention, because we know that that's a determinant for NCD. Anemia, because we know that that's a determinant for stunting in children. So that investment, it's already high in the agenda. We need to continue to prioritize primary health care, particularly with the role of the community health workers. The third thing I want to talk about is we have excellent plans. Tanzania has world-class plans when it comes to national plans for malnutrition reduction. So there's a national action plan for nutrition. There is, and we have worked on this together with Dr. Mazrui, Zanzibar multi-sector national nutrition plan. There's an excellent early childhood development plan, both for in the mainland, and we're supporting government here in Zanzibar for the Zanzibar ones. These are very consultative. They are action-based, they are costed, they are budgeted, and they have all scoped out the role of the private sector. So what we need to do now is three things: implement, implement, implement. And we need to implement while focusing on actionable results that we are achieving and hold all of ourselves to account for those results. So let me end with that. I could go on for long because I'm very passionate about this. Over to you.
Thank you very much, Charlene, for that very insightful discussions. And your passion for the primary health care and the linkages between the community and the health facilities through the community health workers, and also your suggestion to start rethinking the focus on the curative, and rather now, because we're having an increased burden of non-communicable diseases, focus on health promotion and health prevention. So all our panelists have spoken. Now I would like to take a minute or two for each of the panelists to give their concluding remark. And I'll start with the Minister. You're most welcome, Honorable Mazrui.
Thank you very much. After listening to all the speakers here, I believe that all the participants here, they've got an idea of how we move forward together. And myself, I've learned a lot from all the speakers here on how we can work together, private sector and public sector, with only one aim: to make the people's lives better. The economy of this country can be better only if our people are healthier. If our people are not healthy at all, then economy also is not going to be good. So the coordination between all these parts, I think we can make the changes. Thank you very much, World Bank, for your remarks, as well as my dada here from UNICEF, and Aga Khan, as well communication sector, that we need to use technology. Technology can save money. Technology can save time. So as far as I'm here as the Minister of Health Zanzibar, I said that cooperation between private sector and public sector is very important. Real one is very important. Then we can achieve our goals on maternal health, on sex reproductive health, etc. I'm looking forward to see that private sector now, after all what we've discussed here, you will come and work with us. We'll pave the way, we'll build a foundation for you to come and start construction. Welcome. Thank you very much.
Thank you, Honorable Minister. Mwamvita Makamba.
Thank you. A couple things from me. One, there are many revolutions that have happened in this world. Industrial revolution, which Europe has led. But the revolution that is taking place now, the digital revolution, is the only revolution that Africa has an opportunity to lead, right? Technology and digital has immense power to support us leapfrog many development stages. We could be far ahead. So we must start thinking like that. We must digitize. Our governments, our institutions, private sector, development partners, let's embrace technology because it's our savior. We're sitting on a gold mine and we're not taking advantage of it. There's no need to waste 10 months. You can do things in 2 weeks today using digital. So let's work together. And we are looking, in healthcare particularly, we are looking to you, my dada, to lead us on it. We have the tools, we have the capability, we have the money, and we have the will to use digital to support economic acceleration and development in Tanzania. Two, partnerships. We're talking about it a lot, but we're not doing it. We sometimes, as the private sector, don't know where to go. Where do we knock, right? We're sitting with assets, we're sitting with value, but, and we all want to do the same thing. So you see a lot of people doing small pilots of the same thing. But when we come together, we can really, really scale and show impact. So let's have the political will, let's come together, and let's build our nation, and let's do stuff. Thank you.
Thank you very much. You spoke of things that I'm passionate about, the digital transformation, the fourth industrial revolution, which is really something that we can capitalize and leapfrog our progress. Dr. Sarah Maongezi, your concluding remarks.
So thank you very much. My concluding remarks, to attain universal health coverage, we need to do a couple of things. The first one is collaboration. As everybody said, collaboration between the public, private, and the partnerships, but we shouldn't forget the private partnership, because we always talk about the public and private, but we forget about the private. But secondly, quality shouldn't be, it should be a focus of our healthcare delivery. And this will only be attained if we work hard, we persevere, we be consistent, then we can maintain the quality we need at our healthcare facilities. But Aga Khan Health Services Tanzania is ready to collaborate and partner with any institution, any public or private collaborator, or in order to achieve this quality healthcare services. Thank you very much.
Thank you very much. Preeti.
Thank you. I'd say that Tanzania really needs to improve its human capital to have a healthy and skilled workforce, which is needed for the more skilled jobs of the future. And it will not be able to compete in the global economy without lifting its human capital in the country. And improving human capital really requires a whole of government approach. So what does this mean? It means to have a clear strategy, to have clear implementation, to remove all the bottlenecks for implementation, and involvement of the private sector, which is really key, and which is why we are here. Just the fact that we have in this room the representatives from the private sector, we have the government representatives, as well as the other civil society representatives. It's really it's a testament to the acceptance of this fact that we need to all work collaboratively to achieve the development goals, the human development goals of the country. So I would just say that we need to continue to engage, and we are here also to support the government. We are here to support the private sector, and we really appreciate the initiative from the Mkapa Foundation to bring us all together to discuss it and to hear from each other, and just wishing everybody all the best. Thank you.
Thank you very much. Charlene, you'll be there with your concluding remark, please.
Yeah, just to reiterate that if we are to sustain our low middle income country status and indeed graduate into high income country, we do need to break the intergenerational cycle of stunting. We need to address overweight, obesity, and micro deficiencies that we have. And I'm very confident that with this partnership approach, we can do it. The second is that breaking the cycle is going to mean investing in primary health, investing in prevention, reducing the costs that come out of dealing with the impact of all of these foundational issues. So we have no way to go. We have to invest. We are on the right track. We just have to do more. Get primary health care right, especially in the most remote, difficult to reach parts of the country. The third is we know what to do. There are low-cost, very high-impact interventions. I won't go into them. We know what they are. There's also nutrition-sensitive interventions through social protection, through education, through water sanitation in particular, that we can continue to implement, monitor, and tell the story of our excellent results that we are achieving. That's really important. Lastly, planning for today, but also, like I said, keeping the 60 million children of tomorrow in view, which will mean we can't do business as usual. We've got to have partnerships that are vibrant, real, and achieving results through the partnership digitally, and also through making plain old paper-based or ordinary systems more efficient, more effective, and more fast to help indeed Tanzania achieve high income status. And I'll end with saying that I'm really proud to be here as UNICEF, but as part of the wider UN system, along with my colleague Mark, he's here from UNFPA, FAO, WFP. We're committed to helping Tanzania achieve its targets and the SDGs. And tuwezeka utapiamlo kuwa historia kwa Tanzania.
Asante sana, Charlene. We've heard from all the panelists. Now I would like to invite contribution from the floor. So I'm trying to look around. Okay, I see Pfizer. I will start with Pfizer, please.
Thank you, and I'm very honored to be the first speaker. The first commenter. Congratulations to the speakers for their insight, discussion on the role of private partnership. I would like to provide my comments based on the experience learned during the COVID-19 pandemic. I think we all know that during COVID-19 pandemic, we recognize the important contribution of public-private partnership. Among other things, we witnessed laboratory services were outsourced and great results were achieved. I believe there is a big lesson here to move from well-written policies which are not implemented to actual implementation. And recently we've been hearing our national leaders advocating for outsourcing health services to improve accessibility and availability of health services. I believe, this is the good strategy, because we all know that outsourcing health facilities, our healthcare service delivery, allows facilities to narrow their focus and provide best possible care and resources within their focused specialty. However, we should not forget that outsourcing should also consider important measure to ensure all people have equal accessibility to healthcare services. Example, in the areas of service price regulation, we should provide prices that can be affordable to all people regardless of their economic status. And then the second area we should also consider is the provision of government subsidies and use of digital system for transparency and include, among others, related measures. So my point here is public-private policies should be well implemented. However, we need to consider some of these factors to ensure that all people have equal accessibility to healthcare services. Thank you.
Can you introduce yourself, your name and organization that you come from?
Sorry, my name is Faiza Abbas, working with Farmer Access Foundation here in Zanzibar as a program manager.
Okay, thank you very much, Faiza. I saw Sarah Simwe from the Global Fund. She's seated.
Hello. Yes, it's working. Yeah. Good morning, Faustin, Your Excellencies here present, and honorable ministers, and the distinguished panel. My name is Dr. Sarah Simwe. I work for the Global Fund as the Fund Portfolio Manager for Tanzania and Zanzibar. And I would like to thank, first of all, for inviting us to this very important occasion, and just to make a few comments on the subject that the panelists have been discussing. The Global Fund, one of the principles of the Global Fund is sustainability of the programs that are supported by the Global Fund. And what we look at usually is the co-financing and contributions that are made by governments and partners in funding the global health programs that we support for HIV, TB, malaria, and building sustainable and resilient health systems for health. With the COVID, we did expand to supporting the COVID response. But for us to sustain the gains that we have made in all health outcomes, the Global Fund promotes the principle of sustaining programs through government contributions. And what we normally do is we look at government co-financing contributions when we send out allocations to countries. And I would like to announce that the Tanzania and Zanzibar have continuously met their co-financing requirements for the Global Fund to receive funding. And we really work on partnerships and support and through collaboration, both with governments and with bilateral and multilateral partnerships. And one thing that we have been, even at the Global Fund, we have the engagement of the private sector in contributing towards the Global Fund, envelopes. And we do that. Right now we are in our 7th replenishment, where we are looking for funding to support programs. And one of the areas that we have looked at is extension to the private sector to contribute towards the Global Fund. So far, we have received funding of up to $250 million from just the RED campaign, who are private sector, and we also have the Children's Investment Fund who contribute to the Global Fund. At the country level, we want to appreciate the support that we have received. In 2017, I believe we had a very big workshop where we called the private sector through our local fund agent. And we had a campaign to look at how private sector can join governments to contribute towards sustaining health programs in countries. And right now we are exploring opportunities. Some were mentioned by the Honorable Mazrui, Minister of Health, a couple of weeks ago, my head of department met with His Excellency Mwinyi to look at some of these initiatives that have been talked about, extending support to the private sector through partnership with the Global Fund, and many other initiatives that we are pursuing as well in Tanzania. And we look forward to having further engagements with the private sector, especially because we're looking at sustainable financing. We know that both the donor money and government funding may not be they require to be also supported with the private sector contributions, and we look forward to having a line somewhere that says these contributions also came from the private sector towards the co-financing requirements that we have for Global Fund funding. So thank you. We'll join government to continue the efforts to bring everyone in to achieve universal health coverage and maintain the health outcomes that we have so far achieved and that we aim to achieve with the next funding. Thank you very much.
Thank you very much, Dr. Sarah Simwe from the Global Fund. I saw Dr. Shadrach and Minister Simai.
Yeah, thank you so much. Yeah, I would like to join my colleague in supporting their contribution. Yeah, by introduction, my name is Shadrach Scott Maibambe. I'm the President of Medical Association of Tanzania, but present with small R, not capital R. All speakers, including government officials, top government officials, admit the importance of private sector in supplementing the government effort. For private sector to excel, we need a stable policies protected by law and not a fragile policies. For any investors, in the case of any country with a fragile policies, this is going to be a threat for any investment. Investing in private sector is a capital intensive, and once you want to invest, you must invest and not gambling. So it is a long-term investment. So anyone with a good business plan, he must also calculate when is going to break even on that business. So if the policy is fragile, for example, if my expectation of my business is to break even after 10 years, and I invest in the country where the policy is very fragile, and then within 5 years or 6 years, the policy is going to change, definitely I'm not going to break even, and I'll be the loser. So it is very important for policymakers, government officials, to make sure that policies are highly protected and things are not being decided by individual political will. Today we have this minister, tomorrow we have another minister. This one with this policy, another one with the certain policies. This is a threat to investors. So this is very important. The second thing is about incentives. Incentives, you may talk from various corners. But for private sector to excel, you need a good incentives. We have been experiencing in a mining company. For example, a mining company entered the contract that they are going to start giving a dividend after 10 years. But once it comes to the case of hospital, investing in private sectors, the day you open the hospital, all kinds of taxes are going to be there. So we need at least to give incentive, for example, tax holiday for some times, because most of them are citizens. Tax holiday for some years. We need, for example, tax cut in case of medical devices. Through this way, you are going to improve their services, because even the price, the running cost of that hospital is going to be minimal. Even the accessibility to the health sector by Tanzania is going to be easy, because the price is going to be a bit low because of the tax holiday, tax cut from various devices. So it is important to give incentives. It is important to have a good and stable policies for the health sector, the private sector, to excel in our country. All in all, I would like to commend the good job done by BMF. Thank you so much.
Thank you very much, Dr. Shadrach. I saw Minister Simai also raising her hand. Mr. Simai is here, at the front here. I'm the moderator, so the mic should come to the Mr. Smile here at the front. Mheshimiwa Waziri, nyosha mkono akuone.
Thank you very much. My name is Simai Mohamed Said. I'm the Minister responsible for tourism and heritage here in Zanzibar. All protocol observed. The issue of medical tourism was mentioned earlier by Minister Mazrui and I think a few others. And I just wanted to say that us in Zanzibar, we are more open now than ever to work with the private sector. President Mwinyi's government has been initiating in all sectors, not only on the health sector, but in many other areas. And I think, just like, as I know many people here, Mr. Mazrui was mentioning how big Zanzibar is, and I know, Mwamvita, you are a big fan of Zanzibar. The issue of Zanzibar is a beautiful place for, we are talking about the wellness centers, but now we are open for ideas and to listen. Just like what Shadrach has mentioned, us as a government, we cannot take charge and say that we know everything. But based on the requirements, what a potential investor would like to do on the tourism side, the medical tourism, Pemba, now we have allocated Pemba Island. We have special incentives. And I think for anybody who will be interested to set up cosmetic surgery, which is a very huge industry now. People are heading to Morocco, the Middle East, and I think for those who want to improve their bodies, their faces, there couldn't be a better place than to come to Zanzibar and Pemba. I don't know. I mean, Minister Hassan, I think you want to get rid of your belly. For those, I think, can you imagine being in Pemba, beautiful green island, all relaxed there, and you know, it could be even connected to tourism, but we have to be ready in terms of services. We still have a huge challenge in terms of how we deliver our services. So by linking the medical tourism side and for visitors to come to Zanzibar, to enjoy, to relax, but to improve whatever they want to do it, we have to be ready for the service. So I just wanted to make a note of that one, that the issue of services is paramount, but us in Zanzibar, we are more than ready to spearhead the whole initiative of the public-private partnership. Thank you very much.
Thank you very much, Honorable Simai. I know there's a lot of hands being raised, but I think we need to come to the end of our session. And I'll just summarize some of the key issues that came out of these discussions. We can see that a lot of progress has been made, both in the Revolutionary Government of Zanzibar, but also the United Republic of Tanzania, in transforming health services. But we also saw that there are still some challenges in provision of quality health services, but also the area of nutrition, child development, but also what Preeti mentioned about human capital index. But we can all agree that based on the discussion that we've had, there's a room for the private sector. That came out very clearly. And that the private sector can make a contribution to the provision of quality health services in Tanzania. But it was also mentioned that we need to have an enabling environment. That means having stable policies, but also having robust regulatory framework. But again, what is also very important is the political commitment. And we can see that today we have that political commitment. We have the first Vice President of Revolutionary Government of Zanzibar being here. We have the ministers here. Tomorrow we are going to have President Mwinyi with us, and we're also going to have Mama Samia with us. So this shows the level of commitment that the government of Tanzania is put in the health services. But it was also mentioned that we need to have incentives for the private sector that are contributing to social services. This needs to be quantified, needs to be to have some sort of relief for those who are giving. In other countries, they do that. But again, Mwamvita mentioned that maybe it's also a time to relook the corporate social responsibility and looking at now changing to corporate social investments. So this is something that we need to look into. But what also came up is we need to continue engaging the private sector and build partnership between the public and the private sector, but also partnership between the private sector and the private sector. But most importantly, and then lastly, we need all these efforts needs to be properly coordinated. Who is going to coordinate? How that is going to be coordinated? Something that we need to look into. We have laws on the issues of corporate social responsibility in the mining sector. Do we need to have a law across board? Who is going to coordinate? Who's going to identify priorities? Who's going to manage those priorities? So after concluding all this and summarizing everything that is mentioned, I would like to thank all the panelists for very insightful and good contribution. And lastly, I would like to thank the Mkapa Foundation for organizing this symposium. Thank you very much, and thank you very much for listening.
Thank you so much, Moderator Honorable Faustin Dugulile, for the very, very wonderful panel this morning, and the panelists for your contribution. I was following closely, like many others. You did justice to the panel. That's what we expected of you. And being much involved in these kind of issues. At some point, we lost you because of the technical problem that happened, but I could follow. I was going around, I could follow. Just by the gestures and the way you were mimicking words and your hands, we could get the message that you were stressing about accelerating private sector engagement, PPP, on the health. So may I relieve you to go back to the floor, and can we give a round of applause for the great job that they have done? So, now going forward, we are going to taking a photo session, and before I introduce how we're going about, I should take this opportunity to thank you, Vice President, Your Excellency Othman Masood, for actually sparing time to stay with us and to follow the panel. Thank you for donating your time. We understand your itinerary is full, and we will soon relieve you to go and proceed with other commitments. So I should bring on the floor, and the protocol should assist me in doing that. We'll be having two photos today. The first one will be with our distinguished guest on the front row with the board of the BMF, Benjamin Mkapa Foundation, and another one will be with the panelists. So may I invite you in front? Could you kindly send somebody to talk to me? Okay, yeah, so may I invite you in front, honorable ministers, the regional commissioner, our former first ladies, Mama Mkapa and Mama Shadia, and the chair of the Benjamin Mkapa Foundation. Okay, can protocol help us to bring them forward? Yeah, so may I call upon ministers, please take the floor, come to the stage, the regional commissioner, deputy minister, Mama Mkapa, Mama Shadia, Mheshimiwa naomba mkaribie mbele kwa ajili ya picha. Mwenyekiti wa bodi ya Mkapa Foundation, Dr. Adeline Mambo, CEO Dr. Helen Sankoro, watu wa kamera nadhani mmeshakaa sawa tayari. Do you allow me now to invite His Excellency on the floor? Protocol. And last but not least, Your Excellency, can I now invite you on the stage for a group photo? Thank you. Thank you so much. Yes, now may I ask those who are seated, Your Excellency, to remain sitting, and then I invite on board the BMF board to join. CEO, please remain. Members of the board of the Benjamin Mkapa Foundation, please. Taking this last photo, we will allow soon after that for His Excellency First Vice President to depart, and we ask you to stand up and give a round of applause as he leaves the room. And thereafter, we'll be having a health break, and we have two arrangements. First of all, we will be having ministers, first ladies, the family of President Mkapa, permanent secretaries, governor of BOT, members of the diplomatic corps, panelists, moderators and sponsor, chair of the BMF, and members of the board. Kindly proceed to the Jahazi room, Jahazi hall, which is adjacent to this place, for the health break. We'll be having 25 minutes health break. And for the remaining others, including myself, we have a tent at the back of this hall where there'll be a lot of networking and mingling. Will be much more freer and much more fun. So please kindly join there. Yes. And I also acknowledge Honorable Rizwani. Please wave so for people to see you, Deputy Minister of Lands. Thank you very much for coming. Your Excellency, may I now allow you to relieve you, to proceed to the Jahazi Hall for a healthy break. It is now 11:30 and we have 25 minutes, so we're expecting you back here at 11:55 so that we can proceed with panel 2. Thank you so much for your kind attention. Have a good health break. Thank you. Toraga, Minister, nice to see you. Thank you. Ushers, please help us to direct our guests to the right.